right. I believe we are live. So, hello everyone. Welcome to our deep dive. We have not done one of these since last fall, and I'm super excited because I've been working on this one for a while, and I'm really excited about it. Y'all have heard my stories last year about my adventures with discovering I had sleep apnea and TMJ, and I've had just a huge recovery from that, and it's been a game changer for me. It's helped me to I have so much more energy. I have way less pain. So I'm going to share some of the secrets of that or the details with you guys as we get going here. But I'm really excited to bring on Dr. Willey from the Koala Sleep Centers. And he's an expert in sleep, and particularly sleep apnea and TMJ. And he's gonna answer our questions and share some information with us tonight and answer your questions. So if you want to jump on with us live, you can go to www.zoom.us/my/simple wellness, and you can ask Dr. Willey yourself, or you can post in the comments. I'm keeping an eye on those, and I'll ask him for you. So Dr. Willey, thank you so much for joining us today. I really appreciate it.
Thank you, Joyce. It's great to be here.
Yeah. I actually met a gal through your office about a year and a half ago, and well, probably a little longer than that, closer to 2 years ago. And we had the best conversations. You guys know, with me at Practice Simple Wellness, I love to explore natural alternatives. And I'm just one of those people, I like to know things. I like to know what options are. And talking to one of the folks from your office really enlightened me on, sleep apnea and this alternative to CPAP, which is such a big deal. And I just went on my merry way thinking, wow, that's so cool that they do that for people that struggle with sleep apnea. And then in the meantime, I was tired all the time. I'm known in my family for naps. For 20 years, I've been known for naps. And it's kind of a thing. Like if there's a late night event going on, or we're going to be staying up late, it's like, oh, Joyce has to take a nap before we can go anywhere in the evenings, because I just couldn't get through the day, it seems like, without a nap. And if I had to, it was painful. And if you guys are out there, you know what I'm talking about, if you're one of those folks. And it's not that I didn't sleep. I did sleep. I slept 7 or 8 hours a night, but I often woke up feeling like I'd been a little bit beat up. I had a lot of neck and shoulder tension and stuff like that. And I just felt tired. I was tired when I woke up, but it would just get worse and worse through the day until the afternoon. I just thought I was going to die if I didn't lay down and take at least a 20-30 minute nap. And sometimes it's like an hour and a half. And so that's all changed in the last year because of Dr. Willey and his what he does at the sleep center. So Dr. Willey, why don't you first, I think we should let's get everybody on the same page, make sure everybody knows what we're talking about. What the heck is sleep apnea and TMJ, or I heard you reference it as TMD. What are these two things, and what does it have to do with our sleep?
Yeah, so it's very interesting when we go in from twilight sleep, when we first get to sleep, and then we go into the deeper sleep. The further we go into deep sleep, the more our muscle tone relaxes. As it does, the jaw falls back, sides of the throat cave in, roof of the mouth drops down, narrowing the airway. It usually gets the old uvula rattling. If you don't get that elbow on the side of the ribs for some snoring, then you stop breathing completely. Your airway collapses. Deep apnea literally means not breathing, so it's without breath. So the actual definition is when you stop breathing for a 10-second period of time or more in your sleep pattern. Slowed or stopped breathing. Slowed breathing meaning enough that you're seeing a drop in the oxygen level at the same time. So sleep apnea happens from a collapsed airway. Obstructive sleep apnea, which is almost all the sleep apneas. There is also central sleep apneas where the brain doesn't tell you to think, to breathe. But obstructive sleep apnea is a good 95% of it. And that is where the jaw falls back. It collapses the airway while you're asleep. And your brain has only one of two choices: kick you out of the deep sleep or let you suffocate. That's not much of a choice, so it's constantly kicking you out of that deep sleep. Now, Joyce, the reason you're feeling tired all day long is even though you might be in bed 6 or 8 hours sleeping, you're not getting that quality sleep, because when you go into that deep sleep, airway blocks out, your brain kicks you out of the deep sleep to a lighter level of sleep. And then the muscle tone comes back, you start breathing. That happens once or twice an hour, that's not too bad. But if it's happening 20, 30, 50 times an hour, sometimes 100 times an hour, that the more times you get that fragmented sleep, the more your body's not able to rejuvenate. Because here's the problem. Your body repairs itself in deep sleep. So you can end up waking up in the morning with brain fog, short-term memory loss, cognitive thinking, anxiety, depression, feeling like you just got the weight of the world on your shoulders, tired, exhausted all the time. Just stay up all night and see how well you can think the following day. So brain health, it can be really hard on that. And if you let it go long enough, it'll cause an early onset of Alzheimer's or dementia. So a lot of things about that brain health. The brain scrubs itself during the night, all night long. That's how you wake up with a clear mind in the morning. So obstructive sleep apnea is the airway blocking out, causing then this fragment of sleep, creating a lot of problems. Temporomandibular joint disorder is actually a muscle and a joint disorder, two separate things, and yet somewhat connected together. So maybe I should just stay on the line of the obstructive sleep apnea for a moment and go through the rest of those things.
That sounds good.
Not only does it affect your brain, but it can also affect your heart, because when you stop breathing, your brain's yelling at you, wake up, you got to breathe. But another part of the brain saying, no, 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 I got to have some repair time. So it gets a compromise. You hold your breath for 10 seconds, 15 seconds, 30 seconds. It's been shown as much as 2 minutes in a sleep lab where somebody literally held their breath for that long. And you could see their chest just going in and out. You can imagine what their heart rate was doing during that time. And they didn't wake up. So that's why people can die in their sleep due to a heart attack, the main cause being sleep apnea. Because when you're not breathing, that oxygen level goes to the heart. The heart says, uh-oh, whatever oxygen is left, I got to get to that little toe. So it starts working harder and harder and harder, causing things like high blood pressure, enlarged heart, AFib, or unfortunately, heart attack. Heart finally says, I think I'll go on strike. I'm tired of working so hard.
Wow.
Hard there. And the other deal is, Joyce, is the hormones all reset in deep sleep. So when you go into that deep sleep, your hormones will recalibrate, causing things, if without getting that, an imbalance in estrogen, testosterone, thyroid issues, insulin, diabetes, metabolism things, all of the way our hormones that allow us to digest our foods correctly, all get reset in deep sleep. So if you're not getting that proper sleep pattern that goes on, then you could end up with a hormone imbalance. Also a 60% higher risk of cancer, believe it or not, because in deep sleep, oxygen level goes down in the blood. Cancer cells love that low oxygen environment, and it causes them to activate, proliferate. So proven in 2012, 2 research projects that came to conclusion in 2012, proving for the first time that there is a connection between sleep apnea and cancer. A lot of the things, bottom line is whatever the weak point is in our body is where it'll show up. We as human beings require repair time. That's why we require sleep.
Mm-hmm.
We sleep, we don't get the repair time. We end up looking old sooner than we should, and our bodies ache. I had somebody in my office today with rheumatoid arthritis and having problems with sleep. Well, when you're not sleeping, it's causing then your body the anxiety levels to go up, gets the cortisol levels going up as also. It causes inflammatory response in the body, therefore RA takes off. So it'll magnify things like rheumatoid arthritis and fibromyalgia and 1,000 other things because of not getting the proper sleep.
Holy cow. And so to the person that's out there watching this right now, and so what are some signs that they can watch for themselves? Like obviously it's feeling tired. For me, it was definitely, I didn't wake up feeling very rested. I felt tired throughout the day. But some of the other things you mentioned, if you're struggling with emotional stuff, behavioral stuff, and kids, we should definitely mention that because you work with kids and sometimes
Yep.
kids can have sleep apnea and it can show up as behavioral issues and things like that. Can you tell us a little bit more about that?
Well, as adults, if we don't get the proper sleep, we wake up in the morning and we're just a little bit anxious, sometimes a little short-tempered, and you just don't feel well. It's hard to respond well when you don't feel well. That's us as adults. How do you think, how hard is it for kids? So they're tired. They wake up in the morning, they're cranky, they're going around, they become irritable, and they're not getting along well with their classmates. And they're either just they're charging all over the place. Keep any child up all night and see how well he does the next day. Well, what if the child just can't breathe at night? Then he may be getting sleep, but it's such poor sleep, he can't respond well because of these things, causing then things like growth hormone production shut down. So they can end up being immature, both in height as well as emotionally immature. So you can end up with responses from those types of things, being tired all the time, not being able to focus. You can't focus and you're bouncing off the walls. So you take him to the pediatrician. He says, aha, I know what we need to do. He has ADHD. We need to get him on Ritalin or Adderall. That'll fix the problem. So they start medicating these kids when the truth is what they really need is a good night's rest.
Mm-hmm.
Get that rest because of a skeletal structural issue that's causing their airway to block out, causing them not to be able to get the proper sleep that they need at night.
Wow, that's just mind blowing. And I know a lot of the folks in our group are probably like, holy cow, didn't even occur to us, right? Our kiddos are bouncing off the walls. They're struggling. A lot of kids are struggling emotionally, and it's not always just a behavioral thing. It's an emotional component. So this is definitely an area that we would want to get checked out. And I think that's really interesting is I didn't have the traditional, I never considered sleep apnea, because when I think of sleep apnea, I think of those like guys that snore so loud, you can hear them 3 houses down. And so when I didn't do that, and I think a lot of us feel that way. Look, I mean, if it was sleep apnea, I would know if I was going to stop breathing. And when I got tested and found out I quit breathing 15 times an hour, it was a shock. So I'd love to hear your thoughts on that too. Like you may not realize you have it, right?
That's absolutely for sure. And let me loop in one more thing, Joyce, on a sign for the kids, bedwetting. Because bedwetting can happen when a person, your kidneys should shut down at night. But if you have sleep apnea, then your metabolism keeps going. It doesn't shut down. And so you can have kids wetting the bed at 7, 8, 10, 12 years old, still wetting the bed. And as soon as you get the sleep apnea under control, get it treated, bam, bedwetting stops. So even with adults, we find out that they can get up and use the restroom less often because the kidneys shut down at night. So where they were getting up 3 or 4 times a night after they're treated for sleep apnea, they're getting up 1 time a night or not at all. So, but it really can shut that down. But with kids, kind of tough thing, because these kids, they want to be normal. They want to be like all the other kids. And yet they're afraid to go over and visit somebody and, a friend, do a sleepover. Well, they can't do the sleepover because they got this hidden problem that they're ashamed of. So a lot of things with these kids that really makes it tough. Back to the adults.
Yeah.
In your case, yes, you're right. You think of the person with sleep apnea as being the 300-pound, 350-pound big guy, huge neck, and can hardly breathe. And yeah, that's what, but what is the truth is sleep apnea happens to a lot of people that are very thin. You can be extremely thin and still have sleep apnea because it has to do with the skeletal makeup of your body. It's a genetic factor that is in there, the size of the tongue and the airway, the narrowness of the airway. What is true is if there's weight gain, it'll make it worse because weight doesn't only happen in the midsection, it also happens in the throat. So the wider the neck, the narrower the airway. If you were a guy and you have a 17-inch neck size or larger, you have a high incident of sleep apnea. 16-inch for women that is in there. A BMI index that's over 30 is another indicator. Snoring definitely is an indicator. You can have snoring without apnea. You can have apnea without snoring, but they're pretty close cousins. So most people with apnea are going to struggle with some snoring at least. The daytime tiredness we talked about, high blood pressure is another one that is in there. Eating disorders. because two hormones are produced in deep sleep, ghrelin and leptin. It throws those hormones off, and you end up craving starches and sweets, and you don't feel full. So you end up eating sweets and starches, and you overeat. And so you end up with an eating disorder. You end up gaining weight. And of course, the more weight you gain, it magnifies the sleep apnea. The more sleep apnea you have, the more problems we have with the hormone balance. And it's a domino effect that causes a person just to gain a lot of weight. A person will lose about 5% of their excess weight on the average just by getting their apnea under control.
Wow, that's just so amazing. So many things tied in, and it's just most of us wouldn't even think of it. You know, we don't even consider. We just assume, well, if I slept some, then it's fine. And most of us don't realize how important sleep is in general anyway. So it's so interesting. So the other thing I think is important, and I hear this a lot, and I've heard this from people before, and I remember thinking this. Now, I was lucky because I had talked to the gal from your office, and I knew that there was an alternative to the CPAP, but I think some people hold off from getting, they might suspect they have a problem with their sleep, but the idea of having to deal with a CPAP seems like a nightmare. And I knew I wasn't going to be able to handle it. So the minute I got diagnosed, I didn't even wait for the doctor's referral to come back to me for the sleep center at OSF. I called you guys directly because I knew I wasn't going to be able to deal with a CPAP machine. So can you talk a little bit about what do you offer instead of a CPAP? Who is eligible for that? Are there people that can't use the oral devices that you have? I'd love to hear a little bit about that.
Sure. So the two ways of treating sleep apnea. First, the only way to get a diagnosis for sleep apnea is a sleep test. Once we get the sleep test done, then we know how many times per hour you've had slow to stop breathing. If you're in the mild, moderate, or severe sleep apnea, or we ruled it out, you don't have apnea at all. So a sleep test becomes important if you have some of those markers that we have talked about on the signs and symptoms. Then once we get the sleep test, we have sleep apnea, then there's two ways of treating apnea. One is the CPAP, continuous positive airway pressure. It's air blowing down the throat. So you begin to fall asleep, muscle tone relaxes, jaw falls back, narrows the airway, but you got that positive air, sometimes a 45-mile-an-hour wind going down your throat, and it keeps the airway open like air in a balloon. It'll work 100% of the time on a mannequin. 50% of people, though, are trying to pull that thing off their face, and they want to throw it over the cliff because of claustrophobia. Over the face, tethered to a hose, leakage coming off the side, swallowing, bloating air that's in there, sinus problems that are in there, social implications, just the whole bit. So it'll work. It is the gold standard for the treatment of sleep apnea, but unfortunately, 50% of people end up falling out of treatment within the first year. They get tired of it, they can't wear it, and they just can't do it. So fortunately, there's an alternative. The alternative is the dental appliance. What it is a dental solution to the medical condition of obstructive sleep apnea, covered by almost all insurance companies, including Medicare, and virtually all the commercial insurance companies cover it. So it's a good solution. It's rated equal with the CPAP in the mild to moderate range. It works by keeping the jaw forward. So it's a brace. Instead of forcing air down the throat to keep the airway from collapsing, it fits into your teeth. It's custom made. And I forgot to bring mine home with me. I'm at my house. And but it fits over the upper and lower teeth. We take impressions. It's custom made. And it literally holds the jaw in a forward position just enough to keep that airway open. So you begin to fall asleep, your muscle tone relaxes, the jaw falls back. As it falls back, say this is the lower jaw and the airway, it can only fall back as far as we allow it to. So it won't continue to fall back to the point where it'll collapse the airway. So it works as a brace to hold that lower jaw in a forward position so your airway doesn't block out and you can breathe naturally. You can sleep in any position, it goes in your purse or your pocket on trips. You can get up, use a restroom. You're not tethered to a hose. It cleans just brushing your teeth. You just clean it. It's very simple. And I think as you found, Joyce, it's a pretty good solution.
Yeah, I just love it. I mean, it takes, there's a process like, you know, and I think anyone could expect that, right? It's got to be fitted particularly to your mouth. and there's an upper and a lower piece. And so it has to be just right. But Dr. Willey is great because, that the kind of, it's like a fitting, right? And so it's all part of the process and it's all built in so that you just know, like, we're gonna we got to get a mold of your mouth and then we've got to make it. And then you've got to go back several times over the first few weeks to just very fine tune adjustments, they shave tiny little pieces off and get it fitted just right for you. So there is a little bit of a transition period. And then you've got to find the right location. You have a tiny little wrench that's like this big and you just adjust it slightly on each side a little bit at a time. So it's not a big shock to the system. But once you get through that transition period, you can feel, Dr. Willey told me, you're going to hit that sweet spot where we're going to get the right, distance on the, that we've adjusted enough. We've got the perfect fit and you're going to feel it hit. And I certainly did. And I don't ever want to be without it again. I mean, the difference is night and day. I wake up feeling good. I have energy. I get a little tired in the afternoons if I stay up too late, like any normal person, but there are days that I cannot nap. If I feel a little tired, I'll lay down on the couch and relax for a few minutes. And then I pop back up and keep going. I'm so much more productive in my work. I'm a better mom because I'm not so cranky. I'm much more patient. I mean, I could go on and on about it because it's such a huge game changer for me. So I feel super grateful that I already knew about what you did. And so I didn't have to mess around with the other stuff. I've gotten relief and I'm really grateful for that. So thank you.
So it is rated equal with the CPAP, not better than, but equal to as far as effectiveness in that mild to moderate sleep apnea. So up to 30 times per hour of slow to stop breathing. If it's over 30 times per hour, then the CPAP can be a little more effective for the 50% that are able to wear it, and it's not a problem for them. So it works well in the severe range. You usually get about a 2/3 reduction. So it's not that it doesn't work, but it may only reduce it, not eliminate it. We're in that mild to moderate range where it's a good deal. And I think yours was a high end to mild, low end to moderate, or something like that, if I remember right. Stop breathing somewhere around 15 times per hour. So, but that's a lot of fragmented sleep, and as you can see, it really makes a big difference on what you do.
It absolutely does.
Yes.
I've got a couple of quick questions about the sleep side, and then we'll switch over to the TMJ here. Some folks, I had a couple questions about, obviously, once they found out what you do and your options, they were asking if there was a way that they could work with you remotely. Is that possible?
It's pretty tough because we can't mail these out. Could we, get an impression, send it to you? Sure, but it's custom made and it's custom fitted. So the best thing that I could do, and I'd be happy to see where the people are at. We do have dentists that I work with. We actually have some centers around the country. We actually have a franchise, so I am the founder of the whole thing. And it's the other thing I do is train dentists. So we have dentists, and I'm pretty connected in the sleep world. So if you have some that want to get some help in their area, if I can find out, we can certainly search it out and see if we can find someone that could give them some help. But better that they're able to get it done at their house, at their own cities, because it does take some hands-on fitting to get these right.
Okay. Yeah. I mean, like I said, I went back several times over the first, 4 to 6 weeks, getting it just right. So, okay. And then someone had asked, Lindsay in our group here was asking about a specific situation where she's actually, is there a difference between going to sleep and passing out? I feel like I'm so exhausted all the time. The second I sit still, I'm unconscious, even if I'm not planning to go to sleep. What are some ways to improve sleep quality when you have extremely poor sleep cycles? So while you're sharing on that, Dr. Willey, I'm going to grab my oral devices, but you talk a little bit about Lindsay's comment, if you would.
All right. Yeah. So here's the thing is, Lindsay, is it could be just simply you're that exhausted, no doubt about it. You could be that worn out. I've had someone sitting in my office and they fell asleep. They couldn't stay awake while I was talking with them. They were falling asleep in the middle of sentences. So, but the number of times to slow or stop breathing for this particular person once they got a sleep test was 140 times per hour. That's very dangerous. It's fortunate that the person had not died yet. So it can be quite a dangerous thing. And it could be narcolepsy. If you know, that is a neurological disorder where you're just going along, you don't even feel tired, and boom, next thing you know, you're on the floor. Then pretty soon you wake up, you're great, just feel great. Pretty soon, boom, and it just, you have these lapses, or you're in the middle of a sentence and it just stops. So narcolepsy is an interesting thing. It could be a seizure, potentially, something like an epileptic or a neurological disorder of some sort, like that. The way we would differentiate on this is a sleep lab test, where you go into the sleep lab and they'll put a lot of wires in there. They'll be able to figure out exactly what's going on by just tagging some sticky things on your head that they put wires on, and it just evaluates the wavelength of what level of sleep you're in. And then they may even want to do that's a sleep test. They might want to do a wake test. You then they're in the middle of the day and watching you and observing as they're able to catch one of those episodes. They could see what's going on if there was anything going on neurologically. So it could be several things. It could be you're just that exhausted. It could also be a neurological disorder of some sort that's on there, and a number of other things. So I would encourage you to seek out a sleep specialist and get this checked out before you let things go along too far. So that's one of the things you really should go and get checked out.
And I know for me, it was as simple as I was seeing my doctor for other things. I was getting checked because I really thought I had chronic fatigue syndrome, or maybe I have adrenal issues, or I was getting checked for all these other things. So my sister's a nurse practitioner, and she just said, I really think, she's told me this repeatedly over the years, and I've never done it, that I really think you need to get your sleep checked. And so I just mentioned, my sister's a nurse practitioner. She has mentioned that maybe I should get this checked out. So my doctor asked me a couple of quick questions, and she said, yeah, we should probably do an at-home sleep study. So it was all covered by the insurance, and we did the study, and the results came back after a week or two, and sure enough, I had it. So the process doesn't have to be this big complicated thing. Maybe an easy place to start is just to go to your family doctor and, have them ask you those few questions, and start with simple stuff too. So, but yeah. So thank you, Dr. Willey. That's awesome. And then one other question I'm being asked is are these appliances covered by insurance in Illinois?
Yes, they are. In fact, United Healthcare, I'm in network with them. Blue Cross covers it. Cigna covers it. Aetna covers it. Humana covers it. Virtually all of them do. It is also covered by Medicare. The only thing that doesn't cover it would be Medicaid.
Okay.
They don't cover even or pay even enough to cover your lab costs on them. So it's impossible to take Medicaid. But the rest of them we have. In fact, I'm in network with most of them. I am a Medicare provider. So as a dentist, what I have in my office, the Koala Center for Sleep Disorders, I'm basically running a medical office as a dentist. From that, our software is all medical software. We follow all the protocols of the medical community. We work with the physicians that's in there. So it's kind of like a specialty type of a practice, but it's all ran under medical insurance, not dental insurance. So even though I'm a dentist, it's everything we do is treating a medical condition.
Okay, awesome. That is really good to know. And I'm sure those kind of questions will definitely come up. So I do have my sleep device here. I thought I'd just show you guys what it looks like. So it's just like a clear plastic. There's an upper and a bottom piece to it. And then on the side are the two little bars. And like I said, I have a little wrench, and I have a little bag and a kit, which he gave me all the little things to keep it clean. And I've got little carrying cases and things like that. So I just, I brush it every night or every morning when I wake up, and then I brush my teeth, and I put it in at night before I go to bed and rinse it with cold water. And I mean, it's pretty easy to take care of. And we have, it's I mean, I can show you guys what it looks like to put it in if you want to. It
That's
looks
it.
like I'm about to play football.
And you can kind of talk with it in there. I mean, my wife has one also, and so we'll have a conversation. It's a long conversation. She'll take it out, but sure, you get to where you can talk pretty good with it.
Yeah, it's really not a big deal, and it stays right in there. And I just put it in and go to sleep, like anything else. So it's pretty easy. So that's the sleep apnea side. If you guys have other questions, if something comes up as you've heard us talking and you have more questions, feel free to pop them in the comments here on Facebook. I'm watching to see if we've got anything come in. Let me know. And then for the let's switch over and talk. We're getting kind of long on time here, and I don't want to take up too much time, but let's talk about the TMD or TMJ side of things. And I have that roll device here too.
So I'm going to take, and I don't know, Joyce, how much time do we have left here? So I'll know what to do here.
We've been on for about 30 minutes. So, you know, I mean, there's nobody to tell us we have to get off. And I mean, this is great information, but I don't want to keep people too long. So you tell us what you feel like we need to know.
Well, I'm going to give you the Reader's Digest version, and we can kind of take it from there. But what happens, what can cause headaches, jaw fatigue, clicking, popping jaws, ear ringing, neck pain, an opening? All of these things can be caused because of positioning of your lower jaw, and here's how. Since your lower jaw is not connected to the skeleton except for the muscles and tendons, it can obviously be anywhere within the range of the joints. Here's the key to the whole thing. The way you decide how your lower jaw sits at rest is the mind will tell your muscles to get your back teeth together. However your teeth fit best is how your muscles position your jaw. So these cheek muscles have a mind of their own. They are always going to obey the teeth, position your jaw according to how the teeth fit best. So if your teeth fit best, your jaw to the right, the muscles pull to the right. Every time you chew, swallow, bring your teeth together, creating an imbalance in the muscles and an imbalance in the jaw joint. It's better to the left, it'll go that direction. If you have missing teeth, wearing your teeth, braces, dental work, or for whatever reason, if when you close down, your front teeth touch before your back teeth, as soon as the front teeth begin to touch, your muscles will automatically pull your jaw back and up, torquing your jaw towards your ears, then creating stress on your ears. So this is your skull. Get this just right. Your jaw's right here. Okay, your ear is right on the other side. There's a thin plate of bone between the jaw joint and your ear. As you bite down, your muscles are going to pull your jaw back. As it does, it takes the jaw from the center of the jaw joint back towards the back of that jaw joint. You have a collapse of that bite over a period of months and years. It'll gradually pull that jaw all the way to the back of that joint. And now it'll be compressing against that bone, and it starts pushing that bone into the ear space, narrowing your ear space, causing oscillation of the tympanic membrane and constriction of eustachian tubes, causing then ringing in the ear, itchy ear, clogged ear feeling, burning sensation, dizziness, and hearing loss, ear pain. You go to the ear doc, you're thinking you got an ear infection. They'll look in and say nothing wrong with the ears, or they might say try this antibiotic, which won't do any good because it's compression of the jaw into the ear, not an infection. So that compression can cause a little bit of inflammation. So they may look in and see ooziness or some wax buildup and say, oh, you got wax buildup, let's get that out of there. But it's from that compression causing the inflammation, creating then that redness and all of that area that's in there. So the problem is not the ears, it's the jaws. So if you ever have ear issues, go to the ear doc and they can't find out what it is. There's a phrase out there that says, not the ears, check the jaws. Also, then there's a disc that fits between the jaw joint and your skull, keeps from rubbing a hole in your skull. So that disc or pad, and if your jaw gets pulled up because of a collapsed bite, it squishes that disc out of position down and forward, dislocating the disc. Then you begin to open and pop, it comes in, bite down, it goes out. Clicking or popping is a dislocated disc coming back to its corrected position. These muscles that pull your jaw back and up, they're the ones that do all the heavy lifting, and they will always obey the teeth, and it makes them get out of balance, and they're overworking. Overworked muscles creates a byproduct called lactic acid. It causes muscles to shrink like clothes in a dryer. So then you can't open your mouth real wide, or you have sore jaws, sore cheeks. So chewing, talking, smiling, singing, you hold your mouth open for dental x-rays or dental work, sore jaws. When they get sore, they pull at other muscle groups, mainly right here, causing then chronic fatigue of the temporal muscle, creating cramping of that muscle, translating to headaches. And you're rubbing out a gnawing headache. Now that's really interesting because that muscle right there is a fan muscle that sits on the side of your head like so. So it has fibers going forward, over the top, and backwards. It just depends on which one of these fibers cramps as to where you get the headaches. If the forward one's cramped, you got the headaches in the forehead, down in the face, the space that's tension up here, makes your face look tight, makes your brow wrinkle, and you're looking, and maybe people are looking at you, say, "Are you feeling okay? Are you angry?" And you're like, "No, I feel just fine. Why? What are you thinking?" And it's because of this tension look on the face, because it's just all tight. It goes over the head, you get the side, if they cramp out, you get the headaches on the side of the head, maybe a tingly scalp. If the muscle fibers going backwards are the ones that cramp, you got the headaches in the back of the head. So it can be forward, over the top, backwards, one side or the other, or all the above. Just depends on what's cramping as to where you're getting these headaches. That being bad enough, but that pulls down on the neck, makes the neck sore. And the pull down there, it's also a little muscle attachment on the side of the jaw that pulls backwards, triangulates under the earlobe. And then you're over here going like this, and you're rubbing your neck, and you're moving your head back and forth because of a sore neck. Those sore muscle wants to be stretched. So what do you do when you got a sore muscle? Lift your shoulders up, throw your head forward to shorten that neck muscle, giving you the turtle look. Now you're like, relax those shoulders while you would, but every time you do, your neck hurts. So you're up here. This throws you into a posture problem. This head is 10 pounds of weight. It's out of posture. That makes these old trap muscles fire up. Now you're in for a good back massage. They go in and rub those knots out of the back, which are cramped muscle fibers. They pull in the spinal column and can cause cramped, pinched nerves, causing then tingling in the fingers, many times misdiagnosed as fibromyalgia or carpal tunnel syndrome, all due to an imbalanced bite.
Wow. Wow.
So that was
So
a lot. I tried to do it fast. I hope that was.
yeah, well done. That was amazing. Yeah. So the other side of the story, guys, and this one, it was really fast. I also had years and years of neck and shoulder pain. I always had neck and shoulder pain. Never occurred to me I had TMJ because I knew people who had TMJ and their jaw was always cracking and popping and hurting, and they had a lot of pain and they couldn't open their mouth. All these symptoms he's talking about, I didn't have any of that. I just had a lot of neck and shoulder pain. And, and I remember I've mentioned, I felt over the years like I had a lot of tension, like stress in my jaw, but that was only during really stressful times in my life. So I just figured that was just part of being stressed out. And so when I went in for sleep apnea and Dr. Willey evaluated me, he also evaluated me for TMD and immediately said, "You have TMD." And so that was another huge shock. I had sleep apnea, I had TMD. And so I got fitted for the second device. This one just fits on the bottom. And I had relief from this in 3 days, maybe 2 or 3 days, like immediate relief. And I have not been to the chiropractor now in over a year. Years of chiropractic, it's crazy. Yeah.
Yeah, it's really amazing. So your chiropractic work will start staying stable longer once you get this done, because if you're pulling out, your neck is coming forward and your posture is here because of the clinching and the pulling because of the TMD issues, then that pulls on the shoulders, which pulls all the chiropractic out. So they can get all that level, but if this is coming forward, it keeps pulling it out. You have to keep going back over and over and over because it won't stay stable. So so that's really interesting. By the way, TMD, TMJ is the same thing, temporomandibular joint disorder, commonly called TMJ, correctly called TMD, or do you hear TMJD? It's all the same stuff.
Okay.
That appliance that you have in your mouth, what it's basically doing is, the way we treat it is we're saying, okay, muscles, you win. Where do you want to go? We're finding the relaxed position for the muscles, letting the jaw posture to the neutral position of the muscles by covering the teeth, allowing then the muscles to be in charge of the position of the jaw instead of your teeth. Remember in the beginning, I said these muscles, these cheek muscles, have a mind of their own. They will always obey the teeth. So we cover the teeth, put them in a level, exactly level bite with the appliance in place. So Joyce, with your appliance in place, your mind says the muscles get those back teeth together. You're like, it's good when it's back, but if it's just as good if the jaw is forward, right, or left, there is no best bite. Confuses the muscles. They're used to finding the best bite. So they're finding like, okay, teeth, you know where you're going. I'm going to relax, do what I want to do. The jaw postures to the neutral position muscles, allowing everything to heal, like having your arm in a sling, allowing it to go to that neutral position. At the jaw joint with that appliance in, your jaw is hitting sooner, leaves room for that disc, no more clicking or popping. That's not banging into the front teeth, so your jaw relaxes and comes forward back to the center of the joint, takes the pressure off that bone decompresses, ear issues go away. No more clicking or popping, muscles aren't overworking, fatigue goes away, which stops pulling in here. No more headaches. Sensitivity to sunlight, pressure in the back of the head, stops pulling the neck, you can relax your shoulders, it all fades out. We're on the average, we're about 50% better your first week when it comes to the muscle fatigue itself. Headaches, muscle fatigue, not the clicking and popping of the jaws or the ears, those take some time, usually about 6 weeks. So you would wear the appliance all night, much as you can during the day for that 2 to 3 month period. Once we're 80% symptom free, we taper you out of the daytime then you only wear it at night. So the end result is a mouth guard worn at night where the jaw is down forward, muscles balanced. Then you have a daytime stress bite without it, but you have enough nighttime comfort to allow for the daytime stress. And then you wear it as needed. You happen to have something stressing you out, and that's where you're at this point, Joyce, is you wear it sometimes. If you need it, you wear it, but it's like the ace bandage for a weak ankle. Now, deal, you have sleep apnea and TMJ both. We have both appliances. The other appliance, the sleep appliance, is completely flat. The jaw can move, so the muscles are in charge, and it won't let the jaw go back, so it keeps the jaw away from the ears. It's a double appliance, but it can only be worn at night. So that becomes your night appliance. The daytime, when you have to end the day until you're symptom free, then it becomes an as needed appliance. The night one is an every night appliance. That's how the two fit together. Works wonderfully. And by the way, obstructive sleep apnea, the body's best way to fight off apnea is clenching and grinding, which magnifies TMJ problems, throws you into this whole thing. And that's why a good 50% of people with obstructive sleep apnea also have TMJ.
Wow.
Same thing.
You're tying it all together for us. And you can still, I have it in right now. I can still talk pretty good. I take it out if I'm giving presentations or anything, but it feels fine. It's totally comfortable when it's in, it slides in, it sits down here. I can smile and everything. So it works really well. I love it. So
works well. And I think you're at the point now where you're wearing it. How much are you wearing the daytime appliance at this point?
Just every couple of weeks, really, I'll start to feel a little tension come into my neck and shoulders where I start to feel that little bit of stress feeling. And it's also dependent on what's going on in my life. But most of the time I don't need it. It's really just every few weeks, and I'll just wear it for a day or two, and then it goes away and I'll forget to wear it again and everything's fine. So yeah.
There you go. So it's really just both of these are mechanical positioning of the jaw to eliminate both obstructive sleep apnea and DMD issues.
I love it. Awesome. Okay. Well, guys, if you're watching this, I hope you have gotten some really great things to think about. If you're struggling with fatigue, if your kids are bouncing off the walls, if you've got a lot of neck and shoulder issues or headache issues, any of the things that Dr. Willey talked about, it's definitely worth getting evaluated. And you can go to the Koala Sleep Center website. Can you tell us what that is?
koalasleepcenters.com.
Oh, well, that's pretty easy. And go there. And he does have offices around the country. So I know some of you guys do live out of the area. So if you're one of those folks, that's okay. You can check out and see where he's at. And then you do patient evaluations too. So if you just want to get checked and find out if this is you, they can schedule with you to come in and do a session and you kind of evaluate for these things. That's right.
Absolutely. And if it's the kids, I kind of have a soft spot in my heart for these kids. And I am happy to do a free consult to see if these kids, if there's anything. I look at it this way, if I can change their stars, how good is that? Most of the time with these kids, if we catch them at a young age, its guided growth and airway development is completely different than what the system we've talked about. And it just helps the kids grow their jaw in the right spot. It's an appliance that they wear while they're sleeping. It's like wearing a mouth guard while you're sleeping, like an athlete's football mouth guard. So it's neat and it works amazing and it really helps these kids out. So with them, we do the free consult and at least give you an idea where we're at, and then we can kind of take it from there. But if you're having any trouble with it, we'd love to see you. Happy to talk to any of you. And Joyce, if any of them want to reach out to you and they want to call from our office, we're happy to sit down and talk to them anytime.
Beautiful. And there is a center, I know a lot, I've got a lot of people in the Peoria area, a lot of people in Bloomington. Dr. Gray is the dentist in the Bloomington area he's part of the Koala family, and he's the Koala Sleep Center in Bloomington. So, and he's a really nice guy too. I've met with him as well. So yeah, love it. Well, thank you, Dr. Willey. I can't thank you enough for coming on, guys. This is a huge blessing for us. I mean, normally, to get in to see someone like Dr. Willey and get his expert input directly from his mouth, it's a really big deal. So we really appreciate you taking the time out. I know you're super busy, and we sure appreciate it.
Well, thank you so much. I'm very passionate about it. I love what I do. It's extended my career, and I have no intention of retiring. I'm having fun.
Awesome.
So I like doing what I'm doing, and it's working.
Well, you're helping me for sure, and I know you're helping a lot of other people. So keep doing what you're doing. That's great.
Thank you so much.
All right. Have a great night.
Have a good day. Okay. Bye-bye.